discussing about cherubism. So let's begin. So the typical feature seen here is angelic heaven, means eyes looking to heaven. Okay, so it is hereditary or familial fibrous dysplasia, but this term is not used nowadays. Okay, here there occurs expansion of jaw bones, as you can see in the images. So what is happening here, basically there occurs mutation in the SH3BP2 gene, which is located on the chromosome number 4p16.3. Okay, and the disease, it starts at the age of 2 to 3 years, and expansion occurs till 5 years, and from 5 years till puberty the growth decreases, and after puberty regression starts, and when the patient reaches second and third decade, the disease is gone. That is why it is also known as self-limiting. Okay, and remember, it can involve mandible as well as maxilla also. Now let's talk about the etiopathogenesis. So due to mutation, the osteoclasts are activated. Okay, and they start eating the bone, means resorption occurs, and there occurs cystic cavities are formed. Okay, and as the disease grows, they keep on expanding, thus leading to expansion of jaw bones, right? Okay, so that is why it is also known as familial multilocular, because we have lot of locules are there. Cystic disease of jaws, right? And a typical finding here we see is floating tooth, or you can say floating tooth syndrome is seen here. So what occurs basically here, surrounding bone of primary tooth has already gone, thus leading to exfoliation of primary teeth. So it is also characterized by presence of multiple unerupted teeth. Okay, and on histopathological slide, we see multinucleated giant cell, which is nothing but osteoclasts, and hemosiderin is also present. Hemosiderin is because of extravasation of RBCs. And remember, this two thing can also be seen in the hyperparathyroidism and central giant cell granuloma. Okay, and one special feature which is generally asked in the exams is that in cherubism, around the blood vessels, eosinophils are seen, so it is known as eosinophilic cuffing, right? And remember, it is seen exclusively in cherubism only. Okay, and there is a syndrome which is known as Noonan syndrome, which is associated with the cherubism. So the feature of Noonan syndrome are the patient is dwarf, there will be mild mental retardation, there will be chest abnormality, right? So respiration will be difficult for the patient. So respiratory difficulty will be there. Then we have coarse or atypical facial feature and webbed neck. Okay, webbed neck. And one grading system is also there, which is known as R naught grading for cherubism. So first is grade 1. In the grade 1, it involves bilateral mandibular rami. In the grade 2, there occurs involvement of grade 1 plus maxillary tuberosities, means there will be involvement of bilateral mandibular rami also and maxillary tuberosities also. And grade 3, it is associated with grade 1 plus 2 plus entire mandible and maxilla except condyle or coronite. So this is all regarding cherubism.